Well, attention is turning to the impact of ongoing COVID restrictions on children. There's increasing evidence to say that repeated lockdowns result in cumulative anxiety, and referrals for children's psychological issues have grown over the course of this pandemic. Dr. Veronica Harris is a clinical psychologist and family therapist. She says the transition to home-based learning has had a huge impact on our children.
Schools and teachers have put a tremendous amount of thought and effort into supporting home-based learning, and I think we've done pretty well. However, the transition of a classroom model of learning to home-based learning is not an ideal fit, and students are feeling that. Year 12 students in particular, we all know, are having a terrible time in their countdown towards their exams. Younger students have felt it, I think, in three main ways. One of the big differences with home-based learning and classroom-based learning is that in the classroom there's constant support, there's encouragement, there's guidance. Students need direction and support in their learning. They don't just independently learn in a bubble. And that support doesn't replicate well into home-based learning where the teacher's not present. That means that it falls to parents, and parents are trying to check in and support older and younger students to stay on task with their learning, and they're having to do that alongside all their other commitments. For younger students in particular, that's really challenging.
And you've mentioned that it's becoming increasingly more difficult and that you've noticed a real change within your practice in the last 2 weeks in terms of attitudes to home learning.
Yes, absolutely. Students are fatigued. They're struggling to attend classes. They're struggling to stay engaged. They're fed up. And given that we're in this for the longer run, that is concerning. I'm seeing an increase in anxiety, an increase in low mood and depression, even in younger students. And for students with special needs, learning difficulties, disabilities, particularly students with ADHD and autism, this lockdown extending is a big challenge.
Now, the real challenge, Dr. Harris, for parents and teachers right now is not just staying at pace academically, but how can we meet our children's developmental needs during this time?
Absolutely. We really need to focus on their overall development, not just their academic learning. And we need to prioritise their emotional, their social, their psychological well-being. What we know is that we're going to need to make some adjustments. Home-based learning is not going to be able to be a 5-hour-a-day effort. And we're seeing parents and schools respond to that need, cutting lesson times, having shorter days. There are schools that are finishing at lunchtime, having mental health days where students don't attend school. And we're seeing parents also take the lead with that and take their children out of school when they're at capacity, and also select what's a priority to learn and what's not. In all of this, we really need to remember that learning is not just happening in formal lessons. Children learn in all sorts of ways. They'll continue to learn with our support. And the last thing that they need at the moment is more pressure. And the last thing that parents need at the moment is more pressure as well. I think we really need to adapt and drop back the pressure and set more realistic expectations.
Thank you very much for unpacking that with us. Dr. Veronica Harris, they're clinical psychologist and family therapist. Thank you for your time.
Thank you.